Today we are taping NUR 365 NG insertion formal competency, and our student today will be Sarah Enriquez. Start by verifying the healthcare provider's orders for the type of NG tube to be placed and whether the tube is to be attached to suction or a drainage bag.
I verified the healthcare provider's orders.
Perform hand hygiene and gather the necessary equipment and supplies. To include a nasogastric tube, lubricant, clean gloves, tongue depressor, pen light, a Toomey syringe, which is a large slip tip, drinking water and cup, tube fixation device, which is optional, or tape. You can use it, just regular tape to secure it. pH strips, pulse oximeter, and vital signs equipment, and oral hygiene supplies. Provide for the patient's privacy.
I'm going to pull your curtain for privacy.
Introduce yourself to the patient and family, stating credentials.
Hi, I'm Sarah. I'm your student nurse. There's no family present.
Identify the patient using two identifiers, such as name and date of birth or name and account number. Compare these identifiers with the information on the patient's identification bracelet.
Can you tell me your name and date of birth? And do you have any allergies? Okay, that won't affect our procedure today.
Explain the procedure.
I'm going to be inserting a nasogastric tube. So there's going to be a tube in through your nose and into your stomach that's going to help drain your stomach and hopefully help you to feel better.
Assess the patient's cough and gag reflexes.
I'm going to have you sit up. Can you cough for me deep from your chest? Good.
And Sarah's putting on some clean gloves before touching the patient.
Open your mouth real wide. Gag reflex is present.
Using a pen light, inspect the condition of the patient's nares and nasal and oral cavities. Determine which nostril is most patent and use that side if able. Ask the patient about history of nasal surgery or congestion or allergies, and note if deviated septum is present.
No deviated septum is present. Have you ever had any nasal surgeries or problems with your nose? No? Great.
Perform a mental status assessment.
Do you know where you are? Do you know what year it is? And I've already asked the patient their name and date of birth.
Perform abdominal assessment, including listening to abdominal sounds.
I'm just going to listen to your abdomen with my stethoscope. All sounds are active times 4. Abdomen is firm and round. Is your belly painful at all? And tender.
Apply the pulse oximeter and measure the patient's vital signs.
I'm going to apply this pulse oximeter to your finger for during the procedure.
Position the patient upright in the high Fowler's position unless contraindicated. Place a towel or chucks over the patient's chest.
I'm just going to sit you up as high as possible for when we put the tube in.
To determine the length of the tube to be inserted, remember NEX, nose, earlobe, xiphoid. Measure the distance from the tip of the nose to the earlobe.
on to the packaging from the NG tube so that I know the size for my documentation.
So nose to earlobe, earlobe to xiphoid process of the sternum. Mark the required tube length with tape or indelible ink like a Sharpie. Develop a hand signal with the patient so the patient can use it in case of any distress.
If you experience any distress while I'm inserting this nasogastric tube, I just want you to wave at me with your hand.
Apply water-soluble lubricant to the tip of the tube and apply clean gloves. Explain the procedure to the patient, then gently insert the tube through one nostril to the back of the throat or posterior nasopharynx, aiming back and down toward the ear. The patient may gag.
I'm going to begin inserting the tube now into the left side of your nose. This may make you gag. I'm going to have you move your head forward at certain times and take some sips of water to help the tube to become in the right place.
As the tube passes the nasopharynx, have the patient bend his or her head toward the chest. After passing the nasopharynx, have patient lift head. If drinking water is not contraindicated and the patient prefers, provide small sips of water along with encouragement to swallow as the tube is inserted and advanced. Advance the tube as the patient swallows. Emphasize that the patient needs to mouth breathe and swallow throughout the procedure.
And the tube is up to the place where I have marked.
When the tube is approximately 25 to 30 centimeters or 10 to 12 inches, assess for air coming out of the tubing. If the tube entered the trachea instead of the esophagus, air exchange may be heard. If air is present, withdraw the tube and start again. If there is no air, continue to advance the tube to the distance marker. Check the tube position at the back of the patient's throat with a pen light and tongue blade. Ensure the tube is not coiled in the posterior pharynx. Anchor the tube to the patient's cheek with tape. Now we're going to call and verify placement of the nasogastric tube per the organization's practice. Follow order for X-ray verification. Attach a septo or catheter tip syringe and aspirate to obtain about 3 mL of gastric fluid. Put into a small medicine cup or specimen container. Dip the pH strip in the gastric fluid and obtain reading to determine if pH is consistent with gastric fluid. pH of 1 to 4 is a good indicator of gastric placement.
The pH is around 3.
Okay. We're going to clamp the tube. Once the placement of the NG tube has been verified, secure it to the patient's face. Anchor the tube to the patient's nose, avoiding pressure on the nares. Mark the exit site on the tube with indelible ink. Select one of the following options for anchoring. So you can either tape it, you could apply a little tincture of benzoin or other skin adhesive to the tip of the nose. Sarah's wrapping around the tube with the tape. There's also a possibility of using a tube fixation device, and that just slips the connector around the tube where it exits the nose. Label the tubing at a site close to the patient. her gloves and did some hand hygiene there. Fasten the end of the NG tube to the patient's gown using a clip or piece of tape. Do not use safety pins to pin the tube to the gown. Obtain a chest or abdominal x-ray to verify placement and do not use tube until placement is verified. Administer oral hygiene.
I'm just going to clean out your mouth for you.
Clean the tubing at the nostril with a washcloth dampened in mild soap and water.
And I have a warm soapy washcloth here.
Dispose of used supplies. And remove and dispose of used gloves. Perform hand hygiene. Help the patient into a comfortable position and place toiletries and personal items within reach. Place the call light within easy reach and make sure the patient knows how to use it to summon assistance. To ensure the patient's safety, raise the appropriate number of side rails and lower the bed to the lowest position.
I'm just going to lay you down and get you comfortable again. You have your call light.
Sarah will now document the size and type of tube and its placement. Also the patient's tolerance of the procedure and the confirmation of position via x-ray. Sarah has maintained professional demeanor and language throughout the procedure as well as safety throughout the procedure. Procedure is complete.